Your Excellency, your vision mesmerizes all of us. When I left the university, I looked for jobs and could not find one. After doing some consultancy work for free at the Geological Survey and Mines Department under the Ministry of Energy, I saw a great potential in the mining sector that our country was sitting on unexploited. I approached one of my professors at Makerere University for a business loan of Uganda shillings 150,000 to enable me buy a prospecting mineral license from government. Once I had this license in my hand, I went to the public library at Geological Survey and Mines and reviewed all literature concerning the mining sector in Uganda. With all this information and license at hand, I went back to the professor, who was so overjoyed on seeing what I had obtained in a very short period of time. This gave me the confidence to support me with transport to traverse this country in Karamoja, Chisoro, Arua, Ntungamo, and Kabong. After identifying 3 sites, I went back to the professor and I told him I needed another loan to buy hose, hammers, axes, and chisels. The professor was puzzled at one of the best chemists in the country getting wasted. For your information, Magola has a first class in biochemistry. After some time, the professor feared that I could easily be killed because of the insecurity in Kabong by the Karamojong warriors or by the Congolese rebels, so he feared for my life. I then said to myself, Magola, you are finished. After some time, I brought back the same proposal, but this time in a different manner. I told the professor, I kindly request you to go with me to Ntungamo. It is a very beautiful area and no insecurity whatsoever. I am very sure you will love it. Initially, he was reluctant, but after some time, he agreed to the proposal. We jumped on a bus, and after around 8 hours, we were in Ntungamo. We slept the following day. We went to see the mines deep inside the mountains. I saw in his face, he was very, very disappointed. Then he asked me, young man, how many hoes do you want? With a lot of anger, he told me, let me give you the hoe, but it is better go cultivate cassava. I then hired locals to start digging hills in search of minerals. After about a month, I got some kilos of coltan, and when I came back to Kampala, I got the market with a company called Makigem. But because I did not have capital whatsoever, little money I was getting out, I was putting it back into buying some hose and hiring more locals. I continued like this, Your Excellency. With 2 sites after 2 years, I was employing about 3,000 locals in those 2 mines. I had become a role model in the mining sector of this country. One day I asked myself, for how long will I continue using these rudimentary methods to mine? So I devised a way of how to raise money and improve my mining methods, buy machinery, and do proper mining. So I prepared all my files and went for a meeting with the Uganda Security Exchange. They asked me for the requirements, and I had none, apart from my mining license. So then one gentleman in the meeting told me, young man, continue dreaming, but it is very dangerous to dream during daytime. To cut the story short, evil people started hunting for me. For example, someone went on air and said that Magola stole a mine from Chisoro and took it to Busoga. My mining license were suspended and some cancelled without any reason. My success was now curtailed. Remember all this time, at a time when I had finalized the process of being the first Ugandan to have his company listed on the London Stock Exchange. I tried several government officers for assistance without any success. This was after I had partnered with the Indian billion-dollar conglomerate, and one of my friends in Mbarara was a very good friend of the late Muzei Lisi. Muzei, when you were here, I think in June of 2020, you mentioned that. So I went and presented my case to him and begged for the old man's assistance. When the old man saw my tears, he agreed to forward my case to you, Your Excellency. Your Excellency, upon hearing my case, you agreed to help me, and he was surprised that and you were surprised that a very young scientist who is helping find a solution for young people can be treated this way by the same government people who are supposed to assist him. And Your Excellency, you are able to help reinstate my licenses. I think that deserves a clap. Your Excellency, because of your assistance in reinstating my licenses, we are just about to recover Uganda shillings US dollars 300 million from Videocon. Many of you read the newspaper articles. Someone had sued Mr. Magola for recovery. We thank you, Your Excellency, for the support, that we are safe. At one time we had to hide because they had issued an illegal warrant of arrest. This is part of the case that Videocon had to pay our money because of your assistance. Your Excellency, this is what we call a leader with a vision, able to see where others cannot. Your act of kindness to a young boy whom you did not even know from Busoga will soon bring into this country US dollars 300 million. So Dei Biopharma today is investing United States dollars 600 million with the help of our partners Equity Bank, who have given us almost 100 million for the project. Chairman, thank you so much. Your Excellency, your intervention woke up UDB. And UDB has given us almost $20 million for this project. They are represented here by the bank secretary. Is she around? Yes. Thank you so much. Send our regards. Again here, credit goes to Your Excellency for capitalizing UDB, and we wish they could get even $1 billion in order to fund such projects. Your Excellency, much as we've almost raised half of the money needed for the project, we still urgently need funds to complete our campus and raise the remaining buildings as soon as possible. Your Excellency, you were here in 2021 and laid a foundation for the vaccine facility with the then Deputy President of Kenya, who is now His Excellency the President of Kenya. Online, we have our advisors, Professor Safras Niaz, who many Ugandans who are naysayers called Jack Chan.
because we are making life-saving drugs.
With a 10 megawatt power plant, Dei Biopharma has a reliable source of energy, which will be complemented with solar energy in the near future, not forgetting its effluent water treatment system that protects and safeguards the environment.
We have an effluent wastewater treatment that we got from Europe. This one,
Uganda will not be able to grow enough maize, cassava, and potatoes to supply this facility. And that, Your Excellency, is a concern for the backward and forward linkages that this project has in the economy. If we need 5 million tons of maize and 5 million tons of cassava and 5 million tons of potatoes, who is mobilizing the farmers in Uganda that we can buy and have a ready market here? Your Excellency, also, when you came, we laid a foundation stone on a laboratory to support drug discovery and quality assurance. And we called it the YKTM Biotech Laboratory. Your Excellency, with great humility, allow me to tell this audience the reason. After I had been cheated and humiliated by the Indian company in the mining venture, where I told you about earlier, Your Excellency, you helped to reinstate my licenses, and I managed to resurrect. With no money, I sold all my assets and everything trying to pursue the Indian company. I could not even find money to buy food. Now, one day I heard that the Right Honorable Speaker was taking a group of young people to meet Muzei. I said, Otio, the opportunity has come for me to get a chance and meet Muzei again. At the end of the meeting, I put up my hand and Muzei asked me, young man, what is the issue? And I replied, Your Excellency, I have discovered a new malaria drug. Muzei replied, young man, I have other things to do. Your Excellency, I told you I was a chemist. Then you replied, even though, so what? You want to tell me that you went to a laboratory and mixed different chemicals to get a new malaria drug? Then I responded, it is from a plant. Muzei, you said calmly, okay, first sit down. Then you told the other people to get out. Muzei, you started engaging me directly, one-on-one, asking me very technical and scientific questions. I asked myself, Your Excellency, I'm a chemist. And I wondered whether you were a chemistry professor. How did you know so much in the field? Before I know it, you summoned your people and asked them to organize a meeting at Entebbe State House that very morning, which with more technical people. Muzei asked me whether I had a car to take me to Entebbe, and I told him I didn't. He ordered that I was to be driven in his convoy to Entebbe. When we got to Entebbe, the technical team in the field of science had reached, and Muzei introduced me to them and ordered that this great innovation should be funded by the government for the benefit of humanity. He then revealed to me that he was flying to South Africa and I had delayed him for more than 2 hours. He then revealed, at this point, I reminded him that I'm the young man whose licenses you had helped to reinstate. Then Muzei told me as a father, my son, never ever be tempted to sell off that innovation. You will have betrayed the cause of Africa. Your Excellency, I have followed your guidance and vision. And that's why, Your Excellency, Dei Biopharma is your vision. I should have sold my innovation long ago, but every time I remember your words, I can't do otherwise. I can never. Remember all the people whom Muzei had family directed to support this innovation. They started fighting the idea, thinking it was a wastage of resources. And of course, I couldn't access Muzei, so I gave up and started it all out with Dr. Al-Hassan Chakulaga, who is standing here, as we have already explained. It was only Muzei who had a vision of where that innovation would do and saw the future, and the rest could not. We therefore decided to have this facility named Yoweri Kaguta Tibuhaburwa 7 Biotech Laboratories to honor you, Muzei, forever. Muzei, as we wait for the technology to come back on, allow me to thank the following. Mama Rebecca Alitwala Kadag, thank you Azores and having supported us through. I've spoken about the chairman of Equity Bank, the UDB team, but allow me to say just a few words about the team you work with.
The effluent that come from it, we are going to be using it in gray areas. We can use it in gardening, we can use it in toilets, flushing of washrooms and all that kind of thing. We don't discharge effluent which is not as per WHO standard. We are going to make sure that we treat each and everything and even recycle our water, because the plant has been gotten from Europe, to make sure that we conform with international standards of making drugs.
Dei Biopharma strives to be Africa's largest pharmaceutical manufacturing facility and the only integrated company providing all dosage forms in all types of drugs, chemical, biological, and efficient vaccines, providing a solution that will lead research and manufacturing of traditional medicines to serve Africa and humanity.
Because of these machines here to make sure that the perfect granules for the drugs has been made and the fluidization of the drug is dried very perfectly and give us the perfect granules which we need to for the tablet or capsule.
Africa is going for the first time to see products that they've just been dreaming about. We are going to make all essential drugs for the government and actually Africa. Most of the drugs that have been imported, we are going to be making them right here. We have more than 3,000 formulations of drugs that we're going to be making of different forms, tablets, capsules, syrups, injectables, but also different classes. Classes like generics, penicillins, oncology, cephalosporins, biological products like cytokines, recombinant vaccines, peptides, insulin and insulin glargine. All those biological products are going to be making them right here for the first time in Africa. So we've brought technology than never before.
The facility aims at taking care of the needs specific to Africa, using the most modern drugs and therapies, in addition to the essential traditional medicines that will reduce the need to import lower quality drugs.
In Africa, on average, I'm talking about WHO figures, we all import 85% of products, on average, in Africa. Our import bill for medicines and drugs is almost 85%. Now, what's going to happen is that because we've now brought in the technology to make these products in Africa for the first time, and what we are setting up here, we have capacity to make
walls. That is vision. And Muzei, please don't retire. We need you. Because there are very few African leaders who see gold where there is cow dung. But you do. Thank you so much. Muzei, Magola has been antagonized. We have had pressure, including from technical agencies, putting pressure on Equity Bank to record a loan, even before the moratorium expires, to fail the project. We've suffered with clearing things, because you clear this today, the following day, another issue comes up. And we've disturbed your great cadre, John Musinguzi, the Commissioner General of URA, who is here, who is not here, I wish he was, to support us. And he has always written so many letters so that we can get exemption on these taxes. Why can't we get total exemption just like others? But you have stood really firmly with us. We had to go in hiding, you called. We were threatened with arrest, Muzei, you were there. Because you have a dream to see this entire project funded. And we thank you so much and our parliament for taking over your vision. You have always stood up against our naysayers This project became political because the first time Ugandans heard of it, which was when Mama Rebecca Kadaga addressed it. And automatically the naysayers, those who don't understand your vision and development for this country, went after it and demonized it. Magola was called a mofere, yet he is not. Today, I want in front of you to tell them, Muswade. The project is here, the project will continue. Whatever sabotage will come Magola's way, this project will go on and we will serve and produce the medicines that require to make Africa self-reliant. Muzai, I would also request that in the cabinet, these investments are discussed. I would love to see the Minister of Agriculture taking keen interest so that we can benefit from the forward and
especially at the end, we want to thank you so much. When no one could see that in this bush there was gold, Your Excellency, you're the one who saw it. I want to thank you so much. I want to thank you for your continued support. You have not come here once, not twice. I want to thank you for your fatherly support. No matter what happens, I want to thank you so much, Your Excellency, for the great support, for the uniqueness that you saw in Matthias. From long ago, there wasn't any sign that this young man can do that.
Wisdom, which no one can see. I want to thank you so much. I want to keep welcoming you here. We stand firm because the support is so strong. It keeps us moving, and we are ready to take this project to the moon. You know, these days there's the new thing in space. People are going in space. You know. So, Your Excellency, the zeal, the energy, all the power, the energy we put in this is we are going to the moon. And we are going to make Uganda shine. Your Excellency, I really speak from the bottom of my heart. I speak on behalf of Matthias. He will not sleep. If he says, I need to look for solutions. Your Excellency, we've gone through difficult situations, but I want to inform people, you will sleep, you will not sleep, you will not sleep. So we have a great commitment, and we are strong because we have a strong foundation, which is you, Your Excellency. I want to thank you so much, Your Excellency. I want to thank you so much for the people. Your Excellency, I want to thank you so much for the people we have worked with. Sometimes maybe you don't know what is happening, but we have the support of people. Mom has been supporting Dr. Makadaka, Right Honorable Mama Bamasi, Miri Babaranda, Miss Diana, Chairman NDA. We thank you so much. And I want to thank you from Your Excellency, we are thanking our home people. You know you are doing great in them that they come to support us. I want to thank our family members who are here. Your Excellency, we have our family members. My big sorry, I'd say they will not see the President of Uganda, otherwise they will not go to school. Please go to the President, wait to the President. Please wait to the President. The Dei Biopharma staff, they are all here. Please wait to the President. So happy, Your Excellency, for the support, for the love that you have for us. And our commitment to you still stands that we are going to make you proud. Thank you so much, Your
Professor Hassan, you are our technocrat here. 3 minutes to tell us where we are quickly, because in the interest of time.
Thank you so much, MC. Your Excellency, the President of Uganda, I take this opportunity to thank you again for your unwavering support for this project. I first met you in 2020 when we came with the Right Honorable Rebecca Kadaga and Mr. Matthias Mabola, and we met you at Nakasero. I liked your enthusiasm, and you gave us a lot of encouragement to continue this project. But perhaps I need to introduce myself a little bit. My name's Hassan Chakulaga. I was born and raised here in Uganda, but currently I work and live in the United States. I'm a scientist by training with a PhD in pharmacology and toxicology that I obtained at the University of Louisville in the United States. But before I relocated to the US, I was a lecturer at Makerere University, and that is how I came to meet Mr. Magola Matthias. When I was working at Makerere, Matthias approached me, and he had an anti-malaria drug for which he wanted to have some scientific evaluation. That is how we started working together with Matthias. When I left the country and went to the US, I think Matthias had nowhere to do his work from. But then later got in touch with me, and I told him to bring the samples to the United States so that we could evaluate from there, because we had better facilities. Your Excellency, perhaps the most happy person here is myself, because whereas everybody is seeing this project when there are lots of building, I think the concept for this project happened one night. We were driving with Matthias from New York to Chicago. We were taking samples that he had flown with from Uganda to the lab, which was doing analysis for us. Now, because some of these samples were in liquid form, we couldn't fly with them. We had to drive, and this is about 12 hours of driving. So Matthias asked me, because he takes Emirates to the US, which takes him, a flight from, I think, Dubai to the US is like 15 hours. So he asked me a question, that why don't we do this thing at home? Or what would it take so that we don't have to fly the samples to the US for evaluation? Because at that time, we had built a lot of connections, a lot of professional connections, and we had a lot of expertise and support. So Matthias asked me, what would it take to buy these machines and do this work at home? To be honest, I was initially mesmerized, but I believed him. Your Excellency, The rest is history. But I can only vouch for his determination, because when I designed the first facility, I thought he was joking, but he was very serious. For over 10 years, we've been working together on this project. And ladies and gentlemen, I'm also mesmerized whenever I see the facility we have built. Your Excellency, contrary to popular beliefs, humans are only living longer now. And the evidence is glaring for everybody. Most of us here never saw our great-grandparents. And the answer is very simple. They used to live up to about 40 years. Today, humans are living for almost 80 years on average. Ladies and gentlemen, it's not magic. It's because there have been tools that have been developed to curb diseases. Now, what is surprising when we are here is that we used to ask ourselves this question with Matthias, that why is it that our people here, they're so happy driving the latest cars? When an iPhone is produced, I think the next day is on the Ugandan market. But why are we being treated with decades-old drugs? Why is it that we don't want the latest equivalent of an iPhone in healthcare? Ladies and gentlemen, one can argue that the manufacturers of these devices and medicines, they are not interested in these countries. Yes, it could be partly true, but that's not the real reason. Because why else do we have the latest cars? Why do we have the latest phones? The answer is very simple, that medicines and medical devices, they are unlike other products. They are highly regulated products. What this means is that for you to commercialize and sell a drug or a medical device, you have to assume some sort of liability or responsibility for it. Meaning, for someone to sell a drug here, they must be present here to take responsibility in case people are affected by that drug. Now, for many drug companies, this can be very costly, which means that the initiative has to come from within. It is only yourself that is willing to take on this kind of venture. So when we met several connections in the US, we found a lot of support, we found a lot of technology, we brought so many experts that are very much willing to help us establish this facility. Your Excellency, this project was founded on the belief of founding the next generation of anti-malarial drugs. This is a 200-year-old story. Like I've said it before, the first drug that was used in the clinic to treat malaria is quinine. Now, many of you don't know that quinine was discovered 200 years ago in 1820 by two French chemists. The story was someone went to South America and got malaria and fell sick. The locals prepared some concoction, treated that person, and they got cured. So they came back with those bags, and the French isolated quinine from cinchona. Now, it took another 100 years for the Germans to modify quinine to make what you all know as chloroquine. And this was only discovered after the World War, when French soldiers discovered a stash of chloroquine in an abandoned camp of German soldiers. That's when chloroquine started being used massively, because the Germans had secretly made it for their military campaigns. Now, from 1940s, when we started using chloroquine, until the 1970s, no new drug for malaria was made, until the American-Vietnamese War. During this war, the Americans made what they call the Walter Reed Project to develop new drugs for malaria for their soldiers who are going to Vietnam. But Vietnam, being poor, they asked China to develop anti-malarial drugs for them. Now, we all know in the 1970s, China was not so advanced, but they instituted a campaign in which they screened more than 100,000 different plants. And that is how the story of artemisinin came about. It was discovered in the 70s. Yes, it was discovered in the 1970s as an anti-malarial treatment. Ladies and gentlemen, surprisingly, we are still using artemisinin-based drugs. That is more than 50 years ago. There are several lessons we learned from this, Your Excellency, that are important for this project. Number one, from the story of quinine to the story of artemisinin, there is one connecting dot, that knowledge was got from the traditional use of these plants, and they utilized science to isolate the drugs which we use up to today. Your Excellency, the other lesson is that when you look at the number of plants which the Chinese screened, they used bad science. That is the reason why around 2014, the Chinese scientist was given a Nobel Prize for discovering just one minor detail, that when you boil the artemisinin, that's why it was not working. Today we are very lucky that so many tools, we are so advanced that we can harness all this knowledge to develop the next generation of drugs. So Matthias has been pursuing this campaign of developing the next anti-malarial, and that is why, ladies and gentlemen, you see this facility here. As I conclude, Your Excellency, I want to reiterate that we are using decades-old technologies to treat people. I want to give another example which is very cunning. A disease like diabetes. When I come back home, I always see some diabetic patients, they have to get a needle and prick themselves to check their blood glucose levels, and then manually inject themselves with insulin. In the US, they can insert a small device called a continuous glucose monitor on your arm, and it costs only $200. It measures your glucose 24 hours a day. And then you can buy an insulin pump, and the quality of your life does not distinguish from a normal person. So these were the motivations. We want to bring these technologies to our people because nobody else is going to do it. And the reason is what I've said, that nobody we have capsule fillers, we have powders, we have the state-of-the-art LISM dictates that when you do good things for people, you can make a profit. So one of the critical missions of this company is to fetch significant revenues by entering into the global market. So what we are doing is we have got technology to manufacture high-end products like monoclonal antibodies. We'll be manufacturing cytokines, we'll be making vaccines, and because we are setting up this facility to meet the stringent good manufacturing practices, our products are going to be able to enter into the global pharmaceutical markets. Your Excellency, as I finalize and conclude, I would like to thank you so much for your continued support and believing in this project. I know it is a massive undertaking on our side, but with your continued support, I'd like to thank the Right Honorable Rebecca Kadaga. She really believed this project. And my first time to meet you and explain to you this project, she's the one that, brought us to you. So I really want to thank her so much because she has really believed in us. As a scientist, we are leveraging good science to make our products so that they meet the highest standards of quality. As Your Excellency, you can see, there has been a change in technology. When the pandemic happened, people asked themselves, why is it there are no vaccines for HIV or drugs that diseases that have been there for so long? Why did they develop a COVID vaccine so quickly? Ladies and gentlemen, science has changed from trial and error. Now, you first make a drug on the computer before you try it. The computer works thousands of times faster to tell you that don't waste your time on this product. This is what we are bringing here. So we are leveraging on mRNA technology, for which is the basis of making the COVID vaccines. As you see the biologics facility there, it's being built to have those processes that can incorporate what we call mRNA-based technology to produce vaccines, to produce biologics, or to produce any type of molecule. We are so happy, Your Excellency, that the era of one size fits all is gone. We are now in the era of precision medicine. So we make a drug specifically for a particular individual, a particular disease. So Your Excellency, as I finish, that facility is going to harbor that mRNA technology. Thank you so much. Thank you all, ladies and gentlemen, and thank you, for Your Excellency, for coming and gracing this function today. Thank you.
We apologize for the time we've taken because three of us has to do what one man was supposed to do. But Muzei, it is our day. Bear with us. Let me request all of us to stand up and thank Muzei in the best way we know. You can sit. Muzei, after they've sat, Charles Aide, I'll request you to stand. That young man there from Equity Bank, we can't have enough words to thank him. Thank you so much, Charles. And Muzei, we plead, don't get tired of us. We still need you. We need to meet you. Matthias needs to have one-on-one meetings with you regularly for guidance, for support. And we know you will not forsake us. Thank you so much for accepting to come, actually for bringing your good guidance and goodwill to us, to guide us to where I want to be. With those very many words, I would like to invite Right Honorable First Deputy Prime Minister, Honorable Ritwara Kadaga, to say a few words and then invite His Excellency the President to speak to us. Thank you so much.
Your Excellency the President, Mr. Museveni, Right Honorable Mama Mbabazi, Minister for the Presidency, the Magora family, for the rest, I'll stand on existing protocol, lest I make mistakes. But I'm really very proud to be here today to see how far Matthias has come. I think in this gathering, other than his parents, I'm the one who has known him longest. I think we go back more than 20 years. I first met him when he was in Senior 2 at Uzaya Secondary School in the Kamuli district, and we have walked the journey together through school, through university, through the mines, eventually to where he everybody is saying they are happy about what has happened. But believe me, there was a time when the agencies did not even have time for him. This time he came to me very frustrated that he has to continuously explain himself to the agencies because no one thought that an African, Ugandan, is an entrepreneur. They wanted to see a white skin. But he believed in him and supported him. To commission the first consignment going to the US from this facility. I also want to thank Professor Niaz, who was also vilified. I even had to go to Parliament with these books to prove that I'm not dealing with the Wafere. But this is our country. I hope now they know that Africans are capable of doing anything, and that if you have the necessary environment, things can work. So, Excellency, I want to invite you to speak to your people and commission this great facility. Thank you very much.
Okay, let me come back. Just 1 minute.
Every now and then, a new virus, a disease, an epidemic, or a pandemic threatens lives of millions of Africans. But that has been addressed. Dei Biopharma is the ultimate solution to Africa's pharmaceutical challenges. As you approach Matuga, Chigogwa, in central Uganda, 26 kilometers on Bombo Road from Kampala, capital city, the sight of protruding buildings and sky blue glass structures sitting on 150 acres introduces you to Dei Biopharma, a state-of-the-art biopharmaceutical manufacturing plant, the first of its kind in Africa. With the idea conceived in 2013 and a zealous groundbreaking in 2018, the realization and progressive track of the Dei Biopharma has been a journey of dedication, zeal, persistence, and triumph.
When we discovered malaria compounds, and then we took them to the US, in one of the best laboratories in the US, to do further studies on them, and they came out to be potent. They came out to be efficacious. They came out to kill malaria parasites than anything they have known to kill malaria. We are going to be the first FDA-approved facility on the African continent, whereby we've set up a facility that meets all international standards. FDA, WHO, EMA, which is European Medicine Agency, all global standards, stringent global standards, CGMP, we are going to be meeting all those standards.
As the anticipated architectural impression of the Dei Biopharma facility takes shape, it has been built and designed by the best medical structure experts, pharmaceutical engineers, and biomedical consultants from USA and Europe.
We are just completed our generic area plant, and now we are going to qualification. And second, in generic area we will produce tablet and capsule only, and second phase we are going to start for ointment, cream and nutraceutical.
Equipped with the latest pharmaceutical machinery and technology, designed and structured according to WHO, FDA, EMA, and current stringent global GMP standards, with all process equipment purchased from the USA and all utility equipment, HVAC system, and clean rooms procured from Italy, Dei Biopharma has really set the bar high.
Because one thing is very much common and very much improvement in the organization is quality. Quality is a vital role to the organization growth, because we have prepared the mind for the compliance standard. Everybody follow the strictly of rules regulation of GMP compliance, because we are making life-saving drug.
With a 10 megawatt power plant, Dei Biopharma has a reliable source of energy, which will be complemented with solar energy in the near future, not forgetting its effluent water treatment system that protects and safeguards the environment.
We have an effluent wastewater treatment that we got from Europe. This one, all the effluent that come from it, we are going to be using it in gray areas. We can use it in gardening, we can use it in toilets, flushing of washrooms and all that kind of thing. We don't discharge effluent which is not as per WHO standard. We are going to make sure that we treat each and everything and even recycle our water, because the plant has been gotten from Europe to make sure that we conform with international standards of making drugs.
Dei Biopharma strives to be Africa's largest pharmaceutical manufacturing facility and the only integrated company providing all dosage forms in all types of drugs, chemical, biological, and efficient vaccines, providing a solution that will lead research and manufacturing of traditional medicines to serve Africa and humanity.
Because of these machineries here to make sure that the perfect granules for the drugs has been made, and the fluidization of the drug is dried very perfectly and give us the perfect granules which we need to for the tablet or capsule.
Africa is going for the first time to see products that they've just been dreaming about. We are going to make all essential drugs for the government and actually Africa. Most of the drugs that have been imported, we are going to be making them right here. We have more than 3,000 formulations of drugs that we're going to be making of different forms, tablets, capsules, syrups, injectables, but also different classes. Classes like generics, penicillins, oncology, cephalosporins, biological products. Products like cytokines, recombinant vaccines, peptides, insulin and insulin glargine. All those biological products are going to be making them right here for the first time in Africa. So we've brought technology than never before.
The facility aims at taking care of the needs specific to Africa, using the most modern drugs and therapies, in addition to the essential traditional medicines that will reduce the need to import lower quality drugs.
In Africa, on average, I'm talking about WHO figures, we all import 85% of products, on average in Africa. Our import bill for medicines and drugs is almost 85%. Now, what's going to happen is that because we've now brought in the technology to make these products in Africa for the first time, and what we are setting up here, we have capacity to make essential drugs that our people in Africa need. And because of that, we expect to create so many jobs. The first will be to make those essential drugs. Then our next plan is to make APIs. Because you know that Africa, we import 99.9% API. Nobody is making API. What are APIs? APIs are active pharmaceutical ingredients. Nobody is making APIs in Africa. So we have that component that we're going to be making APIs here for the first time in Africa.
Dei Biopharma's niche is in discovering new compounds for drugs, producing all types of life-saving medicines of high quality, and selling them at low costs to Africans and the world at large.
We are looking at WHO registration, FDA registration, and we are going to be selling a number of products across Africa. We do have over 50 molecules in regulation that we're registering with our local authority, the National Drug Authority. And these span from anti-malarials, anti-cancers, even vaccines and drugs that treat emergencies. We are looking at more than 50 molecules within the process of this quarter, such that by the end of the year, we do have all these products registered and serving the Ugandans.
The Dei Biopharma facility will be divided into 9 sections and unit operations that uphold the recommended pharmaceutical processes to ensure top-notch quality, storage, and medical safety. These include Production Building A, suitably designed for the production of all generic OSD drugs except the beta-lactam antibiotic drugs, and all drugs that fall in the nutraceutical class, syrups and ointments. The GLP Laboratory Building, strategically designed for biotech, biological drugs, gene therapy, cell therapy, mRNA vaccines, cancer research, drug discovery, quality assurance and quality control. Production Building B, conveniently designed for ample filling and vial filling for all injectable drugs. The Double Deep Warehouse Building, spaciously designed to be the...
It's really so annoying. People are just there putting on ties. What sort of people are these? So therefore, the NRM, from the very beginning, we told you that please, we want to build a new economy. Economy which is able to stand on its own feet. We don't want economy yokusaka. buli kintu kyonna kyakusaka, importing. But you find people who say they are leaders, they don't care about that. That's why Africa has got so many problems. Jobs for the young people. Because if you are not earning even enough money from the coffee which you say you are growing, you find Germany, a country like Germany which doesn't grow any coffee, earns much more money than the whole of Africa. I will check for me how much money Germany earns from coffee, if you can, on that internet. Ensi etalima mwanyi efuna sente nyingi umumwanyi okusinga fe abalime mwanyi. You know, sometimes we are polite, we don't want to embarrass people, but really, we cannot go on. This time I will have to be very frank to say, So, therefore, I'm very happy when I see some people coming up, like Magora. This young man, you heard what triggered his interest. Two things actually that triggered his interest. The first one was his own experience of chronic malaria, which he was suffering from as a young man, and how he went and was treated by a villager using our herbs here. And then he became inquisitive to follow it up. And he didn't give up. These foreigners are cheating us. I said, how? He said, you know, this use of petroleum, we should not be using petroleum. We should be using hydrogen from water, and we can get hydrogen from water. So I said, this boy is a brilliant idea. Of course, I know about hydrogen, but I had not associated it with powering machines. So I called scientists, very, very known scientists, and I handed them the boy. I don't know what happened to him. I think somebody should look for that boy. And now recently, everybody is talking about hydrogen economy. Can you imagine? Omwana omukiga yankobera ira. Nti hydrogen ekola nemwanjula eri abakulu abandi okumpi. Wapi obutafaayo? I want somebody to look for that boy. I will ask him to look for the boy. To apologize. That please, very sorry. The good thing with the Christian religion, there is provision for forgiveness. It's very convenient that even at the last minute you can say, that's very good for all the sinners. Last minute salvation. So it's really, I'm not happy with this type of people. Now everybody is saying you can now use hydrogen, because, like for instance, we have been talking of using coal for iron ore to remove oxygen from, because iron ore, ferrous oxide, ferric oxide, to remove the oxygen from the iron, and you produce water. Imagine. This is the new technology. But this boy told me this almost 30 years ago. And I handed him to people whom I know who are people whom I thought would help. They never helped. So this is the story of Magora. Naye Magora, yaremeraho. That's why I need to salute him, salute Magora. Now, and you heard how he was being persecuted, being denied his licenses. But he's a fighter. That's how he linked up with one of his friends, a boy who I think is a brother of one of our former commanders, Patrick Lumumba. And then that boy took him to my uncle in the village, in Kashari. And my uncle we went to bury that uncle with Rebecca. She was there to bury that uncle. He died 2 years ago, 3 years ago. So this Mzee brought this boy to me. I had even forgotten what happened. So, but now you have been telling me that that's how he got back his licenses and all that and all that. Now, again now, a new war started between him and the Indians, whom he had teamed up with, who wanted to cheat they went and sold something, I don't know, it's a long story. But they left him out, so he sued them, he sued the Indian. And he got big damages. These are the ones he has been talking about, that $300 million will be brought here from that Indian man who cheated him. So really, I want to salute Magora, salute his family, his wife, and those who have been sticking with him, because this is part of the resistance movement. You resist all these bad people. You don't give up. When we were here, it was the same story. We were resisting. Because we had told, first of all, we didn't even talk to Amin. Amin, we didn't get a chance to talk to him. But the one we used to talk to was Obote. But they didn't listen. So we had to fight. Now Magora has had to fight. And others. Everybody who does something good in Africa is fought by the new colonial Africans. Buli mu Africa ageza ko kole ekyomugaso, Abafrika bali abakolera abanyunyusi bamulwanyisa. They can't see value. Ekyomugaso tebakiraba, balaba ebifu bye balaba. bibatwala ng'ebikulu. So I salute Magora. Now he has struggled, but there are others also. There is a lady called Dr. Muranga. Germany is exporting 21 billion of coffee. Germany. Germany is earning $21 billion from coffee. The whole of Africa is earning 2.5 billion. And they grow no coffee. Africa, abali memwanyi bo bagabanako 2.5 billion. So you wonder, a season of Zinaba Kulembeze or what sort of Zina experts? Do they have experts? What Germany is earning from coffee is almost equal to what all the third world countries, because I told you the coffee business is 460 billion. The coffee growing countries, all of them together, Brazil, Vietnam, all of them, Africa, earn 25 billion. And Germany, from coffee alone, is earning 21 billion dollars. So I am here to salute Magora and his colleagues. And as Chakulaga told you, or was it the other Mihigo, who was saying that now that we are going ahead with this pharmaceutical factory, we now need additional raw materials. Now, one of the raw materials is pharmaceutical grade starch. Kubanga empeke yo jomira, empeke yona sidagala, idagala wateka mukatono. Empeke is just starch. Starch jabateka maka dagala katwale mu rubuto. So the starch is grown in India now. We have got a factory called Quality Chemicals here. Their drugs are still expensive. Why? Because they are using imported starch from India. Yet, from cassava here, we can make starch. And from maize. You heard about the sweeteners to sweeten the medicines. Those syrups are made from sugar. But when we say sugar, we don't mean this sugar of chai. We mean more refined sugar, pharmaceutical grade sugar. So we need to make that sugar also. There is a factory in Chinyara that is now making industrial sugar. I don't know whether that is the same as pharmaceutical grade sugar or what. Chakuraga, Ogamba Chao, Tunyonyori. Industrial grade sugar. Yana kumuzila rowari.
Your Excellency, industrial grade sugar is the one that is used in making things like bread, cakes, and the like. But pharmaceutical grade is much more pure because you have to remove any type of impurity.
Fine. Don't worry.
Yes, thank you.
So I want to assure, you know, these Ugandans are very hardworking. Abana Uganda bakozi, abombyaro bakora. So if you give them guidance, they will do it. Do you know that Uganda is the second biggest producer of bananas in the whole world? Ani alimama toki. There is nothing we cannot do. Okulunda, analunda. Why is Uganda not importing milk? You are not importing beef? I now built for you a factory for leather here in Kaumu. The Ugandans can do this. The problem is not the Ugandan. The problem are the leadership and the technical people. The ones who say they are technical. I don't know what they are technical in what. Technical in irrelevance. Otherwise, the Ugandans don't worry. Is it Michigo who was worried? Don't develop blood pressure, please. The 5 million tons you are talking about of cassava. The other year in Uganda produced 5 million tons of maize. And we were consuming only 1 million tons. We had a surplus of 4 million. But it was blocked by our people, neighbors, they blocked it. So the farmers walked away. But if there is a sure market, that 5 million is nothing. They will produce it. And the Minister of Agriculture is coming in. The government is coming in. We are now, people are waking up slowly. They are waking up. The milk, why do we have so much milk here? We mobilize them. Powdered milk, liquid milk, long life milk. Everything is here. It's from your people. So therefore, I really want to congratulate and support. Support, we shall support you. I want to thank Equator Bank. Equator Bank are clever people. You know, our Kikuyu people are quite clever people. They were Mau-Maus. You know, those Kikuyus were Mau-Maus. So, they have got good spectacles to see where value is. So therefore, Equator, msijali, juhudi ambayo mmeweka, mtapata faida zaidi kuliko mlichoweka. Because you see what we are doing now, Ugandans, the NRM supported by these young people. Because you hear Magora now has gone into the pharmaceutical sector. Nageza ko kubuza abantu abakulu nti ekigambo sector ky'oluzungu mukitafuta mutya. Ne bangamba nti tuyinza kukitafuta nga akabondo. Kati ebyenfuna byammwe bibadde ku bubondo obutono. Emwanyi, chai, tetaba, ebikaado, abasoga, pamba, ebintu bitono ebyo tubaddemu. Naye kati NRM ewagira abantu bano abavubuka bano ereeta sectors empya ezitaliwo, akabondo kamadagala, pharmaceutical sector, big economy. That's now a new economy. Magora liao mukabondo ako akapia Muranga, Dr. Muranga mukabondo ka obuunga bw'amatooke, banana flour and starch. New economy. About Chira Motors, akabondo kebiduka, automobiles. That's a whole economy. So you can see that we are entering a totally new phase of Uganda, broadening and deepening our economic activities. So therefore, all we need here is consensus. If there is consensus among the political class and the business class and the traditional people, the cultural leaders and so on, singa fena twogera olulimi lumu nti ebyenfuna bya Uganda ebipya, a modern economy for Uganda, then we would move very fast. But the problem has been okusikanga n'omugwa. When did I meet Magora first? Can somebody, would mama know? No manyobu na bugana Magora umwaka. No gumanya. Over Mundete. It's many years. So you can see how much time has been lost. And here I am, I'm not, when he came, I handed him some people to help him. Wapi, instead of helping, as Mhigo was saying, at one time they wanted to put him in jail, recently. Can you imagine? Waliwo abantu bange nabo bali awo. Kambaleke kubanga abantu bange nabo. Ebyo munyumba tebitotorwa. You know, wanting to put such a useful man in jail, imagine. Why put such a useful man in jail? Niwe wakunyiza muleke the only ekirala kinabalaba na Uganda. Tibamanyi Katonda. They don't know that if people do bad things to you, but okay, you just leave them. Katonda agenda kubakolako. Naye barwana byobo bitalimu. Somebody like Magoro, if he has done something, you leave him. No, you got to kumuteka mukomera. So my appeal, we are moving slowly. The NRM is there. We are strong, although we get all this lack of coordination, but slowly coordination is coming. So let's now all be unanimous in supporting point number 5 of the NRM 10 points program. Butwava musiko twaja n'ensonga 10. Ensonga y'okutaano, building an independent, integrated, self-sustaining national economy. This has been our struggle all these years. So, the only way we can make work easier for the Magoras. It's not only Magor, there are others. There was this man, Dr. Guang, the one who of the corona medicine. Oh, internal corona. But why? The man has said that he has seen something. You check. Don't rise. Ata amadagala wagechinansi nange ngamanyi, because up to the age of 8 I was actually taking those herbs. I never went to hospital until the age of 8. That's when I saw my mother taking me to the hospital. And there are some drugs. I was working on with Dr. Sharaza, but he died from Barra University. And his widow was there. Then they were fighting the widow. You can't really believe. So, Katonda yebazibwe, for the sake of the people who are trying, I congratulate everybody, and it's now my pleasure. We didn't tour, don't worry, he goes, we didn't tour, but it's not necessary. We saw it here. Corona Chari war. Somebody said it was a lack of time. No, it was not a lack of time. It's that I didn't want to go into those built up areas where there are so many people. Still about corona. I don't have budget for corona to be in the bed and put up my legs and be treated for corona. If I can avoid, we have come here. We have blessed the project. We are going to support it. Omona, I had already told you to organize for Magora to come and see me next week. Let him come and we shall give him all the support. We can't fail to support this. Chira Motors, we support it 100%. Who supported Chira Motors? I don't think Chira Motors have ever taken a loan from any bank. It is the government which supported, because we were convinced about it was clear. And we supported it from the beginning. 100%. So even this one, we can support it once we are, all the players are clear, especially now that the magnitude is a big one. It may end up earning more money than many of the other areas. So, with these few words, I declare the what? The commissioning of what? Of the factory.
Thank you. Thank you very much, Your Excellency. I would request, Your Excellency, that you please lead the VVIP tent to the signing of this placard. So if the Right Honorable Deputy Prime Minister and the Right Honorable former Prime Minister, Minister of the Presidency, and that entire VIP tent, please join His Excellency here. Could Mrs. Kellen Magola, Mr. Benedict Mihigo, and Professor, please join His Excellency in front for that signing. Only those for now, please. Thank you. After that, Your Excellency, I will request that you also give those very same people a photo opportunity.
If you could please join him for a quick photo opportunity. I would also like to ask Your Excellency to please take a photo with the Magola family. So that is the children and Mrs. Magola and yourself. Mrs. Magola and your children, please join His Excellency where he's standing. Very much. Thank you very much. Please head back to your seats for the national anthems as we wind up. Thank you very much, Your Excellency. Ladies and gentlemen, for a successful launch. Have a safe travels back.
We